So we're going to start letting people in. Is that okay? Yeah. Okay. And we are live on Facebook. It looks all good. That's great. Hi, everyone. My name is Daniel from Lifestyle is Medicine, and just want to say hi and welcome to the webinar. We'll get started just in a few minutes here. So in the meantime, feel free to say hi on the chat box, maybe share where you're joining us from, and we'll get started shortly. Thank you. Hi again. This is Daniel from Lifestyles Medicine. Thank you to everyone for joining us. We'll get started in just about 2 minutes here. So thank you. All right. So Dr. Marku, Dr. Cho, ready to start? Okay. All right. So it is 2 o'clock. So we'll get started here. So my name is Dan, Dan Cho from Lifestyles Medicine, and just really want to welcome you to our webinar today. I also want to welcome those who may be watching on our website and on our Facebook Live as well. As we begin here, I just want to note that this session is being recorded and the recording may be made public. So please do take note of that. It's also, as I mentioned, being live streamed on Facebook. So I want to take a moment to recognize our partners for this event. So again, I'm with Lifestyles Medicine. Lifestyles Medicine is a Toronto-based not-for-profit, and our mission is to help people prevent and potentially even reverse chronic diseases by sharing with them the principles of lifestyle medicine. So we go into communities, put on events, health talks. So if you want to learn more about what we do, please visit us, lifestylemed.org. And also there's our email and phone number there. Our clinic partner is Pathways Lifestyle Medicine Clinics. It's a group of naturopathic clinics in Toronto, specializing in the prevention, treatment, and reversal of chronic diseases using science-based lifestyle medicine. They have 3 locations in Toronto that you see there on the screen. And if you're interested to learn more or to book an appointment, there's the information there. I'll also put this information in the chat box as well. And we're all very pleased to partner on this event with Paradise Fields. And I'm going to turn it over to Paradise Fields at this time.
Good afternoon, everyone. My name is Alain. I'm the general manager at Paradise Fields. Even though it looks like my background is from, I'm in Florida right now. I'm in the Northern Hemisphere here in Hamilton, Ontario. So Paradise Fields is a certified organic farm in Hamilton here, Ontario. Also, we have a wellness clinic. Dr. Cho is our resident naturopath there, as well as we have 5 nutritionists that work with us. And the mission of Paradise Fields, it's a lofty mission. We are aiming to grow the most nutrient dense fruits and vegetables on the planet, and use these produce, combining them with lifestyle medicine in order to bring healing to our community. So it's a lofty mission, but we have invested heavily in our soil, in a lot of consulting. And one of our cornerstone project is a 25 bedroom agritourism and wellness center. We have 3 acres on our farm that is dedicated specifically for that. So we're hoping that in the near future, that the city of Hamilton will give us the green light to start building. But that wellness center and agritourism facility will basically help people come and spend a week, 2 weeks with us and get lifestyle medicine treatments. So that's hence the farm and the wellness piece of Paradise Fields. So we are truly excited to partner with Lifestyle is Medicine. This is where Paradise Fields is heading to as well with our wellness center. So we just thank you for everybody who's joining us, and come visit us at the farm. The farm is still operational. Even in the winter, we have a greenhouse. So you can still come and visit us. We'll be more than happy to have you. Thank you.
Okay. Thank you, Elaine. So our presentation today is titled, "Should I Get the Vaccine?" And I'm sure with the rollout of the various vaccines, many of us are asking the question, should we get it? And I think we've heard a lot about the vaccines, but many people haven't heard the actual studies on the vaccine. So that's what we want to do today. We have 2 doctors who's going to actually share with us the actual published data on the Pfizer vaccine and explain to us, and what does it mean when it says 94 or 95% effective and all these other terms? What do they actually mean? So that's what we hope to do today. And just let me take a moment to introduce our speakers. So first we have Dr. George Cho. He's the clinic director at Pathways Lifestyle Medicine Clinics, and he specializes in lifestyle medicine. And he also works at the Executive Health Program at Cleveland Clinic, Canada. So he'll be taking us through the studies on the Pfizer vaccine and also Moderna. We also have Dr. Wilmar Koo. He's a family physician in the Oshawa area, and he'll be sharing with us some natural lifestyle. So the plan today is we're going to take around 40 minutes or so to share our presentation. And after that, we want to get to your questions. So please, as you hear the presentation, if you have any questions, put them into the chat box and we'll try to get through as many as possible. Also for those on Facebook as well, we encourage you to put in a comment, and we're monitoring the Facebook and we try to get to your questions there as well. So thank you so much, and I'm going to turn it over to Dr. Cho. Thank you.
All right, Daniel, if you could let me share my screen here. All right, hi everyone. It's good to see all of you. So my assignment for the next few minutes is to go through the study published in the New England Journal of Medicine for the Pfizer vaccine, Pfizer BioNTech vaccine, and then also look at the published findings from the Moderna vaccine and kind of give you a sense of what the studies actually revealed. Okay, and then we're going to take a little bit of a dive into how lifestyle medicine can play into all this. All right. I hope that you'll find that what we share today is reasonable and evidence-based. Okay, so this is the actual study here, published in the New England Journal of Medicine on the Pfizer BioNTech vaccine. Okay, I think a lot of people have not actually read the study, so if you depend on certain sites or media or so forth, then you might not get the full picture of what's going on. This and for Moderna, they have various fact sheets that you can find online where they actually break down what they actually found. So we want to kind of break that down quickly for you, okay, and let you decide for yourself. Okay, so first a little bit about the vaccine. So both the Pfizer and also the Moderna vaccines are what are called mRNA vaccines. Okay, mRNA is this thing right here. Okay, it's a genetic code essentially. Okay, and there's a lipid nanoparticle surrounding the vaccine. Okay, so this is pretty much what it is. Okay, what does mRNA do? Well, you might remember back in maybe high school biology. So you got DNA here, and DNA transcribes messenger RNA, mRNA. mRNA leaves the nucleus, and then they start to form proteins. Okay, so that's basically what mRNA is, all right? It's transcribing proteins. So then the question is, what protein are these vaccines producing? Well, this here is the SARS-CoV-2 virus, okay, SARS-CoV-2. This is the virus that causes COVID-19. And it has these proteins called spike proteins, all right, the spike glycoprotein. And your body all over the place, in the lungs, the fat cells even, the gut, various places, they have this receptor called the ACE2 receptor, okay, ACE2 receptor right here. And this virus uses the protein here to connect to the ACE receptor, which then allows the virus to go in, okay? So that's what the spike glycoprotein does. The vaccine, essentially what it does, it makes your cells produce this protein, okay? So that's what it does. Okay. Now, what's in the vaccine? Because a lot of people they're worried about the ingredients, right? What's in these vaccines? Well, you have the genetic code, the RNA. You got the lipid nanoparticle. Okay, these are the ingredients here. Other non-medicinal ingredients in the Moderna vaccine are listed here. Okay, so this is a buffer, and these are just some salts and sugar, kind of basically stabilizes the thing. Okay. For Pfizer, it's pretty much very similar. You got the nanoparticle, the lipid nanoparticle, and you got these other non-medicinal ingredients, okay, buffers and salts and things just to stabilize the vaccine. Okay. So in my view, this is pretty simple stuff. Okay. You might wonder, why is there a nanoparticle? Well, it helps to get absorbed. Okay. There's no preservatives, okay, in the Pfizer vaccine, is my understanding. Okay. And no aborted fetal tissues and that type of thing. Okay. So in my view, pretty simple ingredients here. Okay. Also, it's important to note that you are not getting the virus. Okay. So again, you are not getting injected with the virus. You are getting injected with the RNA that that produces, or that makes the body or the cells produce the RNA, the spike protein. Okay. So that's important to point out as well. So basically, you get the vaccine into your shoulder. Okay, the RNA is going to go into your cell. I want to point out, it does not go into your nucleus. So there are some who are concerned about, is this going to change my DNA? The RNA does not need to go into your nucleus, so it's not going to affect your DNA as far as we're aware. Okay, it stays in the cytoplasm. It starts using the cell to start manufacturing spike protein, and the spike protein starts manifesting on the outside of your cell. Okay, so why is this beneficial? Well, hopefully by doing that, your immune system is going to detect the spike protein and therefore mount a response. Eventually, going to produce T cells, B cells, and eventually antibodies. Okay, so that then when you actually face the actual full-on virus, you already have the antibodies available to you. And so the antibodies go and they neutralize the spike protein. And if there's no spike protein, if they're neutralized, then it can't get into your cell and then it can't cause damage. Okay. Also, hopefully you can produce T cells, which can also help kill off the virus as well. So that's the point of the vaccine. Okay, so the vaccine, the RNA, helps produce spike proteins. Your B cells start producing antibodies, neutralizes the spike protein. You also produce T cells to also hopefully be able to kill off the virus when it comes along. Okay. I want to point out just very quickly, you notice that the brunt of the work is done by your immune system. You notice that? So the vaccine is a passive player. Your immune system is the active player. So just keep that in mind, because we're going to get to that later on. Now, there's some concern that people have that this might cause autoimmune diseases. So basically, if the RNA is making you produce spike proteins, then they're worried that your body will become a spike protein producing machine, which is going to mount a massive immune response, and then you're going to get autoimmune diseases. That's not the case, or that's likely not the case, because RNA is quite unstable. All right, so it's not like your RNA is going to be there forever and ever and start producing spike proteins forever and ever and ever. Okay, so RNA is quite unstable. The body will clear it out. Okay. All right. So question number one: is it safe? Okay. Is it safe? So for that, we go directly to the study. Okay, the Pfizer study, and we'll also hit on the Moderna study as well. So in the Pfizer study, they got about 18,000 folks. Okay, and in the Moderna study, it's about 15,000. Okay, they gave dose number 1, and after 21 days in the Pfizer group, they got dose number 2. After about a month later in the Moderna group, dose number 2. Okay, so very similar study design, and they looked at, are there any adverse events? Okay, did anything bad happen to these people? Okay, and they tracked them for approximately 2 months after the second dose, and I believe in the Moderna study it was about 28 days after the second dose. Okay, So they tracked them for this whole period of time, and they tracked them to see were there any bad things that happened. Also, in the Pfizer study, they got a subset called the reactogenicity subset. Basically, they looked at short-term effects. So basically 7 days after getting the first dose, 7 days after getting the second dose. Okay, did any effects happen? So fever, swelling, that type of thing. Okay, and they did something very similar in the Moderna study as well. Okay, so this is the study design. Okay, so let's first look at this here, this, and this. Okay, the short-term effects. Okay, so as you can see here, very quickly, pain at injection site was the main thing, okay, that people experienced. About 80% of people felt pain at the injection site, dose number 1, 2, and same with those who are elderly as well. So essentially, if you get the vaccine, you should expect that there's gonna be some pain at the site of injection. That should probably not come as a surprise to anyone. There's some swelling, some redness, but not too much, okay? This is very similar as well in the Moderna study. Okay, pain at injection site was higher in the vaccine group compared to the placebo group or the control group, and there was some swelling as well, okay? More systemic events that happen shortly after getting these doses. You can see here fatigue, okay, in about half the people. Okay, some fatigue, headache, muscle pain, joint pain. Some people had to use anti-fever medications. Okay, but these were mostly, the vast majority were not severe. Okay, and reality is that lots of these symptoms are probably a result of your immune system being activated. Okay, so these would be probably what you would actually expect. Okay, and same with Moderna as well. Fatigue, okay, in the vaccine group, headache, muscle pain, joint pain, some fever. Some people had to resort to using anti-fever medications. Okay, so basically my conclusion is that for this and this, for short-term effects, it seems like these two vaccines are relatively safe. Okay, the risk of a serious side effects seem quite low. Okay, so that, I believe that is the conclusion, or at least the conclusion I come to as I read the data. How about here? So how about kind of more a little bit longer term, right? Within like the 2 months after getting the second dose, and yeah, any adverse events outside of this time frame, what did they find? Okay, well, there was some lymphadenopathy. So 64 people in the vaccine group got what we call lymphadenopathy. So basically that's just your lymph nodes are swelling. Okay, so it looks something like this. Okay, you got lymph nodes all over the place, and you get swelling when your immune system's kind of being activated. Okay, so 64 versus only 6 in the placebo group. Some of you might be looking at this and be like, oh man, this looks really bad, right? But to be honest with you, lymphadenopathy is likely a sign that your immune system is being activated. And as a proportion, like percentage of the total group, it's very small, okay? Now, in the Moderna study, they found that some people got Bell's palsy. So that's basically facial paralysis. So you see here in this individual, okay, there's some drooping of the eyelid and drooping of the face, and then you see the mouth is kind of drooping. Okay, so you might have seen some people talk about, you know, there's Bell's palsy in the study, right? So that is true. There was some Bell's palsy found in the vaccine group. Okay, so 3 in the vaccine group. Interesting enough, 1 in the non-vaccine group. Okay, 2 are considered non-serious. 1 was considered serious. If you read what Moderna published, they say currently available information on Bell's palsy is insufficient to determine a causal relationship with the vaccine. Okay, so basically their conclusion is that they're not exactly sure whether the vaccine actually caused the Bell's palsy or not. Okay, that's what they're saying. All right, and but I want to point out that regardless of whether it's caused by a vaccine or not, it is a very small proportion of the actual study group. Okay, in Moderna, they studied over 15,000 in each group. okay, the vaccine group and the placebo group. And so, so it is a very, very small proportion of that, okay? So were there any serious events? So caused by the vaccine. Okay, so in Moderna, they found 2 events of severe facial swelling. And this is due to, they found individuals who were using dermatological fillers. Okay, so basically it's like an injection to make your face kind of look younger and things like that. Okay, so 2 people with that history faced severe facial swelling, and 1 case of uncontrolled nausea and vomiting. Okay, and they believe that these 2 was directly caused by the vaccine. Okay, in the Pfizer study, it was 4 serious events that they say that was directly result from the vaccine. Okay, shoulder injury related to vaccine administration. So I'm not exactly sure what happened here, but in any case, there was serious shoulder injury, lymphadenopathy, okay, arrhythmia, paresthesia. Because paresthesia is basically just like weird nervous sensations, okay, in your leg. Okay, so yes, there were serious adverse events. Okay, and this is what they were. Okay, so yes, there is risk of serious adverse events, but it is important to point out that it's a very small percentage of the total group. Okay, so we do need to recognize that there is a risk of serious adverse events, but also recognize that it is a very, very small proportion of the total study group. Were there deaths in either of the groups? So in the Pfizer vaccine study, 2 people that got vaccinated died. Okay, 1 from arteriosclerosis, so basically clogging of the arteries, and 1 from cardiac arrest, the heart stopped working. 4 people in the non-vaccine group died, stroke, heart attack, and 2 are unknown. Okay, in the study, they report that none of this was due to the vaccine, and I personally don't have any reason really to doubt that. Okay. So what I believe is that both short term, okay, and also the longer term follow up or the monitoring, they found that these vaccines are relatively safe. Okay, this is what I believe is the right conclusion when you look at the studies. Okay, so these are totally safe, right? So that's the question. And I think it has to be recognized that they are safe within for the duration that they actually study these people. Okay, so in the Pfizer study, they studied them, followed them up for about 2 months after the second dose. Okay, and for Moderna, it's about 28 days. Okay, so we know that these seem to be relatively safe within that time period. Okay, however, beyond it, there's still question marks. Okay, I think that is the honest assessment of the studies. Okay, and it's not just me making this up. If you look at the fact sheet, the research summary from published by the New England Journal of Medicine about the Pfizer vaccine, it says right there, safety and efficacy beyond 2 months, and in groups not included in this trial, you need further study. Okay, so we can say that within 2 months of the second dose, these are relatively safe, and they're continuing to follow these people for about 2 years, I believe. So we will see the safety profile as they continue to monitor these people. As of now, we can say up to 2 months, it seems like they're relatively safe, but we do have to admit that there is some question marks beyond that. Now, the counter to that is that basically they're saying from previous vaccines, if you don't see anything really bad happening within 2 months, that these are relatively safe. Okay, and that's fair enough. Yeah, you can say that, I guess, but still it does need to recognize that long-term studies are not available yet. Okay, so this is important information to know as well. So let's get some perspective. So on the one hand, those who are worried about vaccines, or you can call them anti-vax, or I call them just vaccine hesitant, they say, some of them are claiming, this vaccine is not safe. I do not believe that that's actually an honest way to characterize these vaccines, because we can say that there is a reasonable level of safety. at least within 2 months of the second dose. So it's a little bit misleading to say these vaccines are not safe, period. Okay. Or some people saying, you know, we don't know the side effects yet. No, we do know the side effects. They've documented side effects. Just that we might not know everything, but we do know that there's a reasonable level of safety, at least within the 2-month time frame. Okay. So we have to be careful how we kind of make our argument. On the other hand, if you look at the media and so forth, they're making it sound like, you know, that this is like totally safe. You know, this is like really, really safe. And like if you're questioning the safety at all, then you're kind of out to lunch. And you know, I think that on the other hand, they should at least admit that, you know, there were some things that were found and that longer term safety has not been confirmed, right? I think that's an honest, also, you have to be honest about that as well. Okay, so I would encourage both sides to at least give the full picture. All right, now, does it work? Okay, so we've talked about safety. Now let's talk about efficacy. So does it work? So you've all heard about the 95% efficacy, right? So, and they get that from the fact that in the vaccine group, only 8 people got symptoms of COVID versus 162 in the non-vaccine group. If you do the math, that's about 95% efficacy, all right? So if you just look at this, you would think that, you know, wow, like this vaccine is super effective, okay? And when people hear 95% efficacy, the automatic conclusion that they're going to come to is the study resulted in prevention of infections, decreased symptoms, decreased severity, decreased transmission, and that lives were saved. Okay. The impression that people can get is that in the non-vaccine group, that people were getting infected left, right, and center, that people probably need to go to the ICU, and that there was rampant transmission, and that a bunch of lives were probably being lost in the placebo group. Okay, so this is the impression that people might get when they hear just this 95% efficacious. Okay, but if you actually look at the published data, I think there's a little bit more nuance than that. Okay, so let's take a look. First, what were they actually looking for in these studies? Okay, so the outcome measures were, the 2 main ones were symptomatic COVID-19 and severe COVID-19. Okay, so basically, did you get symptoms? Plus, did you test positive? Okay, and the second one was it severe? You know, respiratory failure, shock. Did you need to go to ICU? And were there deaths? Okay, so this type of thing. So these were the 2 things that they actually mainly looked at. Okay, so what did they find? Okay, in the Pfizer study, 8 versus 162 after the second dose. This is 95% efficacy. Okay, in the Moderna study, 11 versus 185 approximately. Okay, so this is about 94% efficacy, something around there. Okay, so we have to, it has to be admitted that there was, that the vaccine does seem to help with preventing symptoms, right, of COVID-19. It's undeniable. Okay, 8 versus 162, okay, 11 versus 185. Okay, you can't get around that number, okay? How about severe COVID? So these ones, they looked at symptoms. Did you just get symptoms? Didn't matter how severe the symptoms were. It just, did you get symptoms? It didn't. Then did you test positive? Okay. So let's look at severe COVID. Okay. So in the Pfizer study, it's about 1 versus 9 severe cases of COVID. 1 versus 9. Okay. And in Moderna, it's about 1 versus 30. Okay. So as you can see here, again, the vaccines do seem to lower your risk of severe COVID. The numbers obviously are very small compared to the total study population in both groups. So if you look at Pfizer, it's really 1 versus 9 is impressive. But if you look at like the total study population, the numbers are actually very small overall. Okay, and same with Moderna as well. Okay, but still 1 versus 30 is not something that you can overlook either. Okay. So 8 versus 162, 11 versus 185 when it comes to symptoms. But for severe COVID, 1 versus 9, 1 versus 30. Okay. How about deaths? Because I think most of us would agree that most of us can probably handle some symptoms. We want to know, am I going to die, right? Or am I going to get severe COVID, right? And am I going to die? That's really like kind of what matters. So in the Pfizer study, nobody in the vaccine group died. And lo and behold, nobody in the placebo group died either. In the study itself, it says no COVID-19 associated deaths were observed, okay? In the Moderna study, nobody in the vaccine group and one in the placebo group died from COVID-19. So there was one death from COVID-19 in the non-vaccinated group, all right? So now somebody might say, well, if the study went on longer, then there will be more deaths in the non-vaccine group. And that's definitely plausible, probably even likely, okay? But in any case, this is what the study found, okay? All right, so let's skip here. So I think there's a few things to point out. So first, in terms of symptoms and severe and deaths, it was a very small percentage of the total group, okay, that was actually studied. And the vast majority in both groups either didn't get infected or they got it, but the virus did not affect them enough for them to even seek any help. Okay, so we don't know, but it seems like that is the case. Okay, so what are some conclusions then? There are a few outcomes that really matter with this whole pandemic, right? It's, are you gonna get infected? Are you gonna transmit it? Are you gonna get sick? Are you gonna get really sick? And are you gonna die? These are the things that really matter, okay? And when it comes to these vaccines, it seems like we can say with a certain level of with certainty that the vaccines do seem to help limit the risk of symptoms and also limit the risk of severe COVID, okay? It might help lower the risk of death. It might help lower the risk of transmission and infection, but I think these are still to be determined, okay? I think that is the honest conclusion we can come to when we look at these reports. So if you take the Pfizer vaccine, what the study shows right now is that it may help lower the risk of getting symptoms and severe COVID within 2 months after dose 2. Okay, I think that's the conclusion. The Moderna vaccine has similar results. Okay, at least with certainty, we can definitely say that. Okay, so again, let's bring it home a little bit. So some people who are against the vaccine, they were saying, this vaccine is not effective. Okay, but I think that's a little bit dishonest. This vaccine has been shown to have a level of efficacy, okay, in preventing symptomatic COVID and also preventing severe COVID. Okay, so we have to be honest about that. Okay, to just say this vaccine is not effective, period, I think is a little bit dishonest. Okay, on the other hand, the other side, they're making it seem like the studies show this limits transmissions, that this will prevent me from getting the virus, that studies show that this saved lives and things like that. And really, these are still, I think, kind of to be determined, to be honest. So I think it's important to kind of tell people kind of the nuance of what we've actually found. Okay, so I think this is the way to kind of look at it. And if you don't want to believe me, maybe you'll believe Dr. Fauci. So Dr. Fauci was on a podcast, the JAMA Network podcast, in a conversation with Dr. Bachner. Dr. Bachner is the editor-in-chief of JAMA, the Journal of the American Medical Association. Okay, and this is what he said. Okay, so this is Dr. Fauci himself talking. Okay, so it's really simple. The primary endpoint upon which the 95% efficacy was determined was based on the prevention of clinically recognizable disease, not asymptomatic, not infection. Okay, the secondary endpoint was protection against severe disease requiring hospital intervention. It was also a secondary endpoint, though it wasn't clear whether we could reach it, but we are still looking at that. Does it protect against infection? So he's saying we're not really clear about whether it's going to protect against infection. Okay. By the way, this talk about Pfizer specifically. okay, not Moderna. So he continues, a typical scenario could be A, that someone is protected against infection and clinically recognizable disease, but there's also a likely scenario that there is someone who is protected against clinically recognizable disease, but still have replication competent virus in their nasopharynx, hence by definition, they are infected. Basically, very simply what he's saying is the vaccine could help limit symptoms and severe COVID, but you might still have some of the virus still left. And so technically you're still infected, okay? The question is A, we don't know yet. Hopefully data in a long-term follow-up or subsequent trials will determine whether or not you have a significant inhibition of actual infection. Okay, so whether it prevents infection or not, he's saying we don't know yet, okay? The other thing that's a little bit more complicated is that it is conceivable that you could be protected against clinically recognizable disease. You could, however, get infected, but the level of immune response that protected you from clinically recognizable disease would be enough to lower the titer of the virus in your nasopharynx such that you would not be infective. So you could be infected, but not have enough virus in your nasopharynx to transmit it. So we don't know the answer to those last two questions. So basically he's saying the vaccine could maybe lower the viral load so that you're not transmitting to other people. See, that's a possibility, but I think we don't know yet. But of course, they're going to continue looking at that, right? So does it protect against infection? And if you are infected, does it render the viral load so low that you are not transmitting it to anyone? Basically, he's saying, we don't know. Okay, so even Dr. Fauci is saying, we don't know. Okay, so if Dr. Fauci doesn't know, I don't think we know either, okay? So I believe the fair conclusion is that it's going to help, it's going to possibly lower the risk of symptomatic COVID and severe COVID, and possibly very likely maybe even lower the risk of death. And these are also possibilities as well, but it's kind of to be determined at this point, okay? Now, very quickly, before I turn off to Dr. Marcoux, how about lifestyle medicine? Does lifestyle medicine have anything to do with this? And what have we learned from previous vaccines, okay? This is Dr. Gregory Poland, okay? He's head of vaccine research at Mayo Clinic, all right? He's 100% pro-vaccine, okay? Look what he says here. This is a paper from 2018. Vaccines are much like seatbelts or airbags in cars. Maximum protection against injury or death occurs when they are used properly and in the right setting, but they are no guarantee of absolute protection and safety. So you see here, he's saying vaccines are no guarantee. Why is that? Well, optimal vaccine immunogenicity occurs when the host is healthy with highly functioning, innate adaptive humoral and cellular immune systems intact. So notice here what he's saying. He's saying to get really optimal response to vaccines, you need a highly functioning immune system, okay? Immunocompromising medical conditions, diabetes, obesity, and other things like cancer, and their associated therapies can lead to insufficient or absent immune responses to vaccines. So this is very interesting. This is coming from an individual who's he has credible credentials. Again, head of vaccine research at Mayo Clinic. He's 100% pro-vaccine. Okay, but what he's saying here is that, look, vaccines are good, but really to get an optimal response to vaccines, you need a good immune system. That's essentially what he's saying. All right. So, and to illustrate that, I want you to take a look at this. So pretend that this is a vaccine. So this is not necessarily the COVID vaccine, but this is just some vaccine, okay, with a weakened virus, okay. And so when your body encounters something like this, it mounts an immune response, okay. So B cells get activated and you form antibodies and memory B cells, okay. Same thing on the other side, you get T cells that need to be activated as well. So you form killer T cells, memory T cells, helper T cells, and this is overly simplified, okay. But as you can see here, in response to a pathogen or even a vaccine, you have a whole cascade of immune events that need to take place. As you can see here, the main work is done by your immune system. It's not done by the vaccine. Okay, so the vaccine relies completely on the human immune system in fact, the immune system is the main primary and critical player. All right. And I think that most of us, we get that, but I don't think a lot of people have really let that sink in. Okay. And I think it's kind of lost in the conversation how critical your immune system actually is to even respond to a vaccine. Okay. So if this is not working properly, if this is not working properly, then really you might limit the effectiveness of even this, the vaccine itself. Okay. Obesity can cause immunosuppression. Okay. Inflammation caused by immunosenescence and other chronic diseases can also lead to immune suppression as well. Okay. And for lack of time, we're going to just skip this. Okay. So basically, right now, it seems like in the conversation that people are making it sound like it's one way. The vaccine helps the immune system. Okay, so they're making it sound like it's only one way. But I want to argue that it actually goes both ways. That the immune system, that the vaccine also needs a healthy immune system as well, or at least to really make it effective. Okay, so as much as a weak immune system may benefit from a vaccine may be rendered weak by weakened immune system. Okay, I think you can't get around this. All right. So this is where lifestyle medicine comes into play. Eating healthy, like a plant-based diet, for example, exercising, sleeping well, and even practices like hydrotherapy, hot and cold therapy, that type of thing can also really help kind of keep your immune system kind of at an optimal level. Okay, so your lifestyle is critically important here, and I think this is something that's being lost in the conversation. It's not to minimize vaccines at all, but it is to say that to just talk about vaccines without talking about being healthy overall is really, I think, a little bit of misplaced priorities. Okay, so lifestyle medicine is also critical in the future as well, and this is where I want to end off. Okay, so here, this is Dr. Ryan, and he's part of the World Health Organization. And in a news conference recently, just a few weeks ago, actually, he made some very startling remarks. Okay, and I want you to take a look at them. He said, "I'll say one thing that will come as a shock to people. This, talk about COVID-19, is not necessarily the big one." Isn't that shocking? Okay, so he's saying something bigger is going to come in the future. This virus is very transmissible and it kills people, but its current case fatality is reasonably low in comparison to other emerging diseases. So basically he's saying, watch out, something worse is coming. Okay, this is a wake-up call. We are learning we're learning now how to do things better. These threats will continue. So COVID-19 is not the last pandemic. There are worse ones coming. This is what Dr. Ryan is saying, and he's from the World Health Organization. If there's one thing we need to take from this pandemic, with all the tragedy and loss, we need to get our act together. We need to get ready for something that may even be more severe in the future. In this, we must honor those we've lost by getting better at what we do every day. So he's saying we need to get better at what we do every day, and we need to wake up. I believe we need to wake up to the fact that our lifestyles actually matter, that we need to take care of our immune system. Okay, that's what I believe we need to wake up to. Okay. Now, right after he made that comment, this doctor, she's a vaccine researcher, she came on and she said that basically the World Health Organization had the foresight to prioritize vaccines, okay, and medicines to deal with pandemics. And basically, they're kind of patting themselves on the back. Okay, but what I believe is that I believe this is a little bit misplaced priorities, okay? Because in the future, if we wait for vaccines and we don't take care of ourselves in the meantime, then there's gonna be so many lives lost. So in this pandemic, we saw SARS-CoV-2. It started to hit the world and spread rapidly. And before COVID vaccine came out, we have over almost 2 million people that are dead. Okay, so basically, if Dr. Ryan is right, and that in the future there's going to be even a more deadly and more fast spreading virus, if we're just going to sit on our laurels and not take care of our health and just wait for a vaccine, then the time in between, how many people are going to lose their lives? You see? So it's like kind of like in World War II, you know, before the Americans came up with the atomic bomb, you still have to fight the Germans and the Japanese. You can't just sit around and just say, okay, let's just wait for the atomic bomb. No, you have to still fight, right? So it's the same thing in the future. If another major pandemic hits, well, before a vaccine comes out, you know, we need to still fight, right? And the only thing you have left at that case is your immune system. And so in this whole conversation, we can't forget how important our immune system actually really is, okay? Okay, so I want to just close out by saying what I believe is that living a healthy lifestyle is primary medicine, and that vaccines are secondary add-on medicine. This might be a little bit controversial maybe, but I believe this with all my heart. It's not saying that you shouldn't get the vaccine or that vaccines are not important. No, I believe that these can have a very important role. But if you're just going to get the vaccine and just kind of keep on fooling around with your health overall by not living a healthy lifestyle, may I suggest to you that your priorities are misplaced. I believe that really it's this as primary and this as secondary, and that whether you get this or not, that definitely this is essential. Okay, and you know, for certain people this may be essential too, but I think that this is being lost in the conversation, and I think that we need to really bring this to the forefront, along with kind of try to get effective vaccines out as well. Okay, so with that, I'll turn it over to Dr. Marcoux.
Thank you, Dr. Cho. So Dr. Marcoux will take a few minutes to share with us some natural lifestyle approaches. Thank you.
Right. So with a 95% efficacy rate, if we vaccinated the entire population of the US today, we would still have 15 million or more, like half the population of Canada, coming down with COVID. So what I would like to share is to mirror some of the comments of Dr. Cho, in that if our immune system is low, then our ability to actually have a positive response to the vaccine will also be low. In fact, there were studies where people were sleep deprived and then given the flu shot, and their ability to enact immune response and for that flu shot was much less than those that had a healthy sleep. So I'm just going to share my screen here. Share. Okay. All right, so basically, we know that if we do get exposed to COVID, and we have two phases of the disease, and that first phase is our time where your immune system can really be benefited by simple things. And the first thing I'd like to share, I'm basically going to share 3 or 4 laws of health. Basically, sleep, specifically melatonin, vitamin D, the sunshine vitamin, and then some quick thoughts on the use of essential oils and hydrotherapy. Now, this first slide is basically your production of melatonin. Now, it was interesting that early on in the COVID pandemic, a research group out of the Cleveland Clinic, using AI to investigate the structure of the virus and how it invaded tissues, we're looking at other human hormones that could potentially block the virus, and their findings found that melatonin could potentially block the virus. And indeed, this has been verified. A study out of Columbia University found that it even decreased, so it increased survival rates of intubated patients if they received melatonin. And it also decreased the odds of developing symptoms early on in the course of the disease. There was even a group of sleep scientists out of the University of Texas that published a plea for melatonin to be immediately given to everyone with COVID and recommends everyone to take it as a preventative. But most sleep experts agree that even more important than supplements is getting the body's own melatonin cycle working effectively and regularly. And unfortunately, this pandemic has adversely affected our sleep habits. There was a survey out of the UK that found that 75% of people had a change in their sleep habits for the negative, and that 50% were now reporting unrefreshing sleep. So it's really important to build routines. But I wanted to show you this particular slide. This study looked at the effect of light on the production of melatonin during the night. And you can see from these 3 volunteers, they took blood samples of their melatonin levels through the night, and noticed that if they were exposed to light during their sleep hours, they had these are the decrease in their production of melatonin, 92%, 90%, and 79%. And they were only exposed to a 200 lux light source. Now, I just grabbed a light bulb from my basket in my house, and I have a 60-watt light bulb here, and it produces way over 200 lux. And in fact, if you're watching TV at night, a TV screen, a 65-inch TV screen, will produce almost 2,000 lux of exposure. So you're going to really affect the production of the melatonin if you expose yourself to light during the night. So let me just, now the other thing is that let me just see here. There's one study here that showed that if you are sleep deprived, that you have a greater risk of catching cold. Now, the way you catch COVID is very similar to the way you catch a cold virus, a rhinovirus. And so again, it's very, very important that you get regular sleep of more than 8 hours. And it's been shown that the hours before midnight are twice as beneficial for your immune system than the hours after midnight. And the reason that's so is because it's early on in the night cycle that you're getting your delta wave sleep, which is the restorative sleep. And your growth hormone is affected. Okay, I just want to quickly go on to a couple other things. Vitamin D has been shown to be important. SARS positivity rates are inversely related to your vitamin D levels. So the higher the vitamin D level, the less of a chance of turning positive. Likewise, in terms of fatality rates, if you have a normal vitamin D level, you have a much lower rate of death than if your vitamin D levels are very low. So Dr. Youngberg out of California recommends that if you come down with any sort of respiratory symptoms, to take 50,000 units of vitamin D for 3 days. And he recommends 10,000 units daily. So we need to make sure that our levels are up into the high normal range. Here's an article showing the fact that eucalyptus essential oil enhances the innate cell-mediated response. And the results of this study said that it demonstrated that eucalyptus essential oil was able to implement the innate cell-mediated immunity. So again, I have a bottle of eucalyptus oil here. When I have any respiratory symptoms, I like to do steam inhalations. I recommend to my patients boiling 4 to 5 liters of water in a kettle, pouring it in a basin, 10 to 15 drops of the essential oil, creating a little towel tent and giving yourself a steam inhalation. Also to do cupping throughout the day, where you just carry the little bottle around with you, and every couple hours, drop 1 or 2 drops in your hands, cup the hands together, and give yourself a treatment. Now, I just show this as we go into the hydrotherapy segment of my talk. You'll notice that COVID, this is a chest radio, a CT chest of a patient with COVID pneumonia. And what you see is the the SARS-CoV-2 virus has a predilection to attack the periphery of the lungs. And that makes it very positive to be treated by heat. And here's a study that says that the structural stability of SARS really degrades with temperature. And that's where the hot and cold packs would really be effective. Now, this is a study out of Toronto, where it was actually funded by the US military. And what they did is they applied a cold exposure following heating, and they observed that there was a statistical significant mobilization of circulating cells, increased natural killer cells activity, and circulating interleukin-6 concentrations. So there again, to improve your immune response, the application of 3 to 5 minutes of a hot pack followed by 10-15 seconds of a cold pack, or if you're not used to it, having a hot shower on your chest and then having just a basin of ice water outside the shower curtain, and every 3 minutes just step out of the stream, grab that face cloth, rub the chest for 10 seconds, and then repeat for 3 cycles. And that will help the immune response and also decrease the likelihood of increased infection. So here's a study saying that the interleukin increase is very, very significant once you heat the body up to 39 degrees. So hot baths, for example, has been shown significantly to activate the immune response. Now, this is a fascinating, now we have, our last pandemic, of course, was the Spanish flu. And this shows that there was they compared the US Army to Adventist Sanitarium outpatient and Adventist Sanitarium inpatient death rates and pneumonia rates, and where the hydrotherapy techniques were being used extensively in these healthcare centers that were run. And it shows here that there was a 7 times greater risk of pneumonia in the US Army with their treatments, and a 5 times greater death rate than those that were treated with more simple hydrotherapy techniques. So in closing, I just want to say that vitamin D and sunlight can impact our immunity to reduce morbidity with COVID. Natural substances may impact our immunity in positive ways. Sleep and its consequences have a major impact on our immunity, especially when it comes to viral infections. And the most important part of sleep is at the beginning of the night before midnight. And then hydrotherapy also impacts our immunity, especially our innate immune system, which is crucial in fighting COVID-19. Okay, I'll stop screen share.
Thank you, Dr. Marcus. Fascinating stuff. So we are at 3 o'clock. So we do like to respect everyone's time. So what we're gonna do is just take a few questions and just kind of answer them really quickly, related mainly to the study, just for understanding. And sorry, we can't get to all the questions, but we try to respect people's time. So first, Dr. Cho, we have a couple questions on the placebo. what was in the placebo? What was the placebo?
Saline.
Saline. Okay. Wonderful. Also, there was a question online: who conducted the studies for Moderna and Pfizer, the vaccines?
I believe it was the company themselves. Yeah.
Okay.
Some people might find that to be problematic, and yeah, I guess there is kind of a conflict of interest there, but yeah, that is they did conduct the studies.
Hopefully in the future it will be replicated.
Yeah, exactly. Yeah.
Yes. Okay. Excellent. And also, can you just repeat what you mentioned about the fetal tissue? We got some comments online in the chat as well.
What I was saying is that there is no fetal tissue. So basically, some vaccines, there's like the whole concern about they used tissues or stuff derived from aborted fetuses, right? So in the Moderna and in the Pfizer vaccine, they did not use stuff from that. So people who have moral reservations about, using that type of stuff, they can be rest assured that it doesn't seem like these two vaccines use that.
Okay. And lastly, we had some comments about, if, especially when you talked about lifestyle, if someone has a healthy immune system, do we need to be vaccinated?
That's a good question. I don't know. Maybe I'll turn that to Dr. Marcoux.
Dr. Marcoux?
Well, whether you get vaccinated or not, your immune system is the important component.
Okay, right. So kind of go back to what Dr. Cho has shared. All right, well, so we are gonna close it there. So I wanna just thank everyone for joining us today. I wanna thank you, Dr. Cho and Dr. Marcoux for your sharing your time and your presentation with us. We wanna thank our partners. And in our email, we'll send everyone who registered a link to the various references and that we referred to in this session. So thank you so much. We hope you stay healthy and we hope you tune into a future event. Thank you.